Hello and welcome to the program. I'm your host, Neil Howard, here on Health Professional Radio. In studio with us this morning is Dr. Joshua Yamamoto. He's a cardiologist and medical director at Foxhall Medical in Washington, D.C., and he's also an author, the author of You Can Prevent a Stroke. He's joining us here on the program to talk about the four major advancements in the nation's stroke prevention paradigm. Welcome to the program, Dr. Yamamoto. Thanks for joining us.
My pleasure. It's great to be here.
Now, I did, of course, mention that you're the medical director at Foxhall Medicine in Washington. Was cardiology your first love when you entered into medicine?
Actually, it was not. I started in medicine doing emergency medical work. After a background in the sciences, I worked for the fire department as a paramedic and was very interested in helping people in times of need. And to be honest, that was one of the prompts that drove me along a pathway to realize that it's a lot better to prevent trouble than to keep trying to fix things that are broken.
Now, what is a stroke exactly?
A stroke is what we call a cerebrovascular accident. Cerebral means brain. Vascular refers to our circulation. So, in fact, a stroke is damage to the brain from interrupted or inadequate circulation. And in most cases, that means a clot getting up into the brain, causing a lack of blood flow and damage to the brain.
So what's the best way to treat a stroke?
The best way to treat a stroke is absolutely to prevent it. Once a clot gets into the brain and there's damage to the brain, occasionally we can try to rescue that, and it's always worth doing. So if someone does have a stroke, you want to seek medical attention immediately. But unfortunately, the results of an injured brain are usually quite tragic. And we always think of a stroke as a tragic and random event, and it is tragic always, but it's not typically random. We know what causes strokes. We know how to anticipate what's going to happen, because indeed, most of the changes in our circulation that lead to strokes are the result of a natural aging process. And none of us are immune to that aging, and that means the aging of our heart and our blood vessels, our circulation, and our heart's rhythms is something that's entirely predictable, it's measurable, and that makes it manageable, so you can prevent a stroke.
So when it comes to preventing stroke, is it something that we need to start looking into early in life? How do you prevent a stroke?
The important thing is to remember when we look at preventing a stroke is, first, aging is inevitable, and most of the changes to our heart and circulation are the result of age in the context of who we are, what our family history is, and all of the things we know that accelerate aging. And so the next thing is to know that we can look at the effects of aging, because we don't know our health on the inside until we look. And we have some exciting new applications of well-established ways of looking at our health, and that then empowers us to make changes.
Now, at the outset of our conversation, I said that we were going to talk about some advancements in this prevention paradigm here in the United States. Let's talk about some of these advancements in stroke prevention. You talked about looking in and checking, seeing what our health is and not knowing about that until we look. So I'm assuming that, you're talking about frequent periodic testing?
Exactly. In the Foxhall Foundation, we have a mnemonic or a memory device to help our providers and our patients think about how to look at their own health to prevent a stroke. And we say it's D heart. D as in a doctor. You need to work with your doctor to look inside at your health. And then you ask about H, your heart, A, your arteries, and R, your rhythms, to know about your health. And T is, then we ask, is it time? Is it time to do something different, or time to take a medication, or time to change how I'm living my life?
Checking on all of those things gives you a good idea of whether or not you're susceptible, whether or not you're a candidate now or maybe later down the road.
Exactly. And it's important to understand we are all susceptible to a stroke. And strokes are very much like heart attacks, meaning a heart attack is interrupted circulation to the heart. A stroke is interrupted circulation to the brain. And indeed, heart attacks and strokes are the leading cause of death because age is the leading cause of death. And so if you ask about the health of your heart, there are many different technologies that let us do that, but functional testing is just one of them. Our brain lives or dies on the health of our heart. Can we get circulation to the brain? And we can ask about the health of our arteries. That's pretty easy to do with a lot of non-invasive testing. It's just a question of understanding how to ask and knowing where you are And perhaps the most important thing is understanding that the regularity of our heart tends to wane as we get older. The older we are, the more likely we are to have irregular heartbeats. And we often talk about something called atrial fibrillation, which is truly just the sustained irregularity of a heartbeat that is seemingly inevitable as we get older for reasons that are actually very well understood.
So let's say that you suffered a stroke, you're on medication. How do you know that this is the medication that's going to work? Is it a different medication, or is it not working at all? How do you just take it and hope for the best?
That's exactly the points of prevention of a stroke. Our paradigm today, and what we've always been taught in medical school, is that when somebody has a stroke, then we investigate their heart, their arteries, and their rhythms to understand why that stroke happened so that we can prevent a second stroke. And in fact, we don't have to wait for the first stroke at all. We can do those preventive measures, those investigative measures before the first stroke. It's all about knowing which questions to ask, and everybody should ask the questions. And then the answers change from person to person. We are not static. As we go through time, things do change. There are new treatments coming available, and there's some very exciting new treatments now that you as a person, whether you've had a stroke or not, can ask your doctor, hey, is this the right medicine for me at this time to prevent a stroke?
So there are medicines to prevent a stroke once you realize through your functional testing and maybe your ultrasound or something like that, that you are at risk. Now you can take medicines to prevent that.
Exactly. There are many medicines we have to help us prevent our risks of strokes. We talk commonly about reducing risks, and that's important. The common risk factors, if you will, are smoking, diabetes, higher blood pressure, and higher cholesterol. But our new way of thinking is not to say these are just risk factors, but to say these are the things that accelerate natural aging. And so controlling those things is very important. But even beyond that, there are many things we can do to live a healthy life to help control diabetes, blood pressure, and cholesterol, and to not smoke. But beyond that, once we know the health of our heart, once we know the health of our arteries, and perhaps most importantly, once we know whether or not we're having irregular heartbeats, then we can say, should I be on a medication? Am I growing plaque in my arteries? Do I need to arrest plaque growth? We can often do that. Do I have a heart that's not working as efficiently as it needs to? Do I need a medication to protect it, to keep it stronger, or to prevent the pressure from weakening it? Do I need a pacemaker because it's too slow? And am I having irregular heartbeats? And if that's the case, there are absolutely medicines you can take to prevent the first stroke.
Let's talk about some of the things that, you talked about non-invasive testing. You talked about functional testing. I've heard of people having monitors, once they find that they have an irregular heartbeat or there is a problem, that there is a monitor that is, inserted to kind of keep track of what's going on and maybe to regulate medications.
One of the most exciting advancements is an evolution in technology of how we can monitor the heart. We have monitored the heartbeat since the days of the Apollo missions so that we could follow the heartbeats of our astronauts in space. But that technology has now advanced over the last 50 years into very compact, portable, and in some cases, implantable devices. And as of this year, in 2019, the Medicare Services has approved what we call the in-office implant of a tiny little microchip, which we call an implantable cardiac monitor. Mm-hmm. And imagine something no bigger than a paperclip that with a little numbing medicine, you can just slide under your skin. And this little chip will record your heartbeats all the time, 24 hours a day, without your having to do anything. And that matters tremendously because we have irregular heartbeats that we often don't feel. Symptoms do not predict risk. Waiting for symptoms before you start asking how to prevent a stroke is perilous. We like to joke that's akin to using an altimeter to look for a waterfall. By the time the altimeter tells you you're dropping, you long miss the opportunity to avoid that hazard altogether.
Yes.
And so if we have a monitor that records and says, oh, look, you've had a run of atrial fibrillation, maybe it lasted hours or days, and maybe you didn't feel it because, in fact, most irregular heartbeats are not clearly identifiable by symptoms in the early stages, but they do increase your risk of a stroke. And what's even more amazing with our new technology is that these monitors can now automatically and effortlessly pair with our own cell phones to send your doctor an update when you're having an irregularity. So in my practice, every morning I get a series of emails to say, hey, which of your patients were having AFib, or which of your patients had an irregular racing or skipping heartbeat? And then I can ask the question then, am I doing everything I need to help prevent a stroke for that person?
Doctor, where can our listeners get a copy of your new book, You Can Prevent a Stroke?
The book was in production all last year, and we're very proud to say that we don't tell anybody what to do. We try to teach everyone what they can ask and what they should ask. The book is being released on Amazon at the end of July, so within about a week. It's available anywhere booksellers or at your local bookstores or online through Amazon, Barnes & Noble, or you can even go to our foundation's website, foxhallfoundation.org. We're a nonprofit, and all the proceeds of the book go to support our efforts in the nonprofit opening up wellness and prevention programs, principally here in Washington, D.C.
Dr. Yamamoto, thank you so much for joining us on the program this morning.
All right. It's been my pleasure, Neil.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. Transcripts and audio of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to this podcast on iTunes, listen in, download at SoundCloud, and be sure and visit our affiliates page at hpr.fm and healthprofessionalradio.com.au.